Hey everybody, thanks for joining me today again for another CHOT training minute. RN case managers, this one is for you. Just a brief refresher on what we need to do in the process for home health aides when they notify us that there were ADLs that were declined and weren't performed that are on their aide care plan. So if and when one of your aides gets a hold of you and says, "Hey, Miss Smith declined today her shower." That's perfectly fine. Obviously, we know that, but we need to document that the aide did inform us of that. That's one of those things that CHAP or the state, when they walk in, will be looking for. And specifically, when we just had our survey, they did look for coordination of care. So, just a quick, brief refresher. I'm sure most of you know how to do this. But just to be able to put in a note of that coordination of care between the RN and the home health aide. So when we're in our tablet, if you click the three buttons at the very top right, that's going to bring up a menu, and we tap medical records. Then this will give us a whole list of all the patients that we have access to. So we'll, for example, go into our top patient here, and then you'll see all of the history items that we can bring up. And at the very bottom, it says features. We'll need to tap that so we get that drop down so we can see everything that's open to us as far as our options go. One of those is notes. So we're going to tap notes. And then at the bottom, we're going to tap add. We've already determined this is our patient, but at this point we could, in theory, if we pick the wrong patient, pick any other patient, the correct patient. And then under the type, this is the type of note, and they're all coordination notes, but they're all labeled differently, so they make it easy for us to sort as we're looking for particular notes. You'll notice that there is one that's called hospice aid collaboration. So when your HHA contacts you and lets you know anything about that patient, it's good to put it in that hospice aid collaboration note. Again, it's a blank note, so you're just going to type in here that which aide contacted you about the patient, what services were declined, or any conversation that you have that needs to be documented there. Once you do that, you're going to save it. It will go directly into the record. You don't have to be obviously in a visit. To do that, you can do that completely outside of visit, just like we did here. So that's all I've got for you today. Hopefully this helps. If you need anything or have any questions, as always, don't fear to reach out to me via click or email. Hope you guys have a great week and a great weekend, and we'll talk to you later. Thanks.